Hey everybody, welcome to PermanenteDocs Chat. Thanks all for joining today, both on Zoom and on Facebook Live. Today, I'm very excited for our special guest. I'm going to fanboy a little bit here. I don't think he needs any introduction, but Dr. Kevin Pho is an internist and the founder of KevinMD, who is going to talk about a topic near and dear to my heart, social media, and explore physicians and other healthcare professionals' role in and around social media today. So should be a great topic. Please feel free to drop your questions in the chat or in Facebook comments as we go along here. We'll try to get to them too. Dr. Pho, thank you so much for joining us today. Like I said, I'm a huge fan of your work and really helping start, I think, a lot of the trend of physicians getting more active on social media. Let's start off by just telling everyone who you are and what you do.
Sure. Well, thanks so much for having me. My name is Kevin Pho. I'm an internal medicine physician. I'm also the founder and editor of KevinMD.com. And it's really just a platform where I share the voices of healthcare professionals across the spectrum so we can share their stories and be heard.
Yeah, fantastic. Tell us how you came up with KevinMD and how the story of how this all started.
Yeah, so I like to say I had a business plan back in 2004 and it went exactly according to plan, but that's obviously not the case. So back in 2004, very few physicians had blogs, probably less than 50, maybe 75 or so. And then at that time, it was a novelty of a physician having a blog. It was like, really, don't you have anything better to do with your time? But I think I wrote an article once where there was a drug recall. I wrote an article saying what patients should expect. And then I went into the exam room a few days afterwards. And he said, oh my gosh, I read your blog post this morning. I was comforted by what you had to say. And that's when I realized that blogs specifically, and now of course with social media, we had abilities. Physicians have the ability to connect with patients and influence patients and inform and educate patients outside the exam room. And certainly there's been a fantastic evolution. Social media has evolved so quickly. There's so many different platforms that we can choose. And there's so many different ways that patients can consume health information. And it's been a fun journey along the way, just exploring social media and doing things that frankly, none of us have been taught in medical school or residency.
Yeah, that's such a great point. I think every time I'm passionate about social media as well too, and I educate our residents and some of our medical students about that at my institution here. And I always talk about expanding the voice. So you can educate one patient at a time in the hospital or the clinic, or you can educate en masse. And I think that's such a valuable tool, especially this day and age when, as you mentioned, there's so many different ways patients can consume health information. And let's be honest, not all health information is created equal. Shall we? Can we just agree to leave it at that?
Yeah, so there's absolutely no question about that. One of the most popular reasons why patients go online or do Google searches is for health information. And especially during the pandemic, there's just so much misinformation that is out there. People get their information from Facebook, from Twitter, from YouTube, and they come to my exam room and I have to spend time, and I'm sure you do too. You have to dispel that information. And I think that it is certainly a responsibility for a lot of us in healthcare to also go on social media and either be themselves sources of reputable health information or really act as filters so we can guide patients a better source of health information. Because not just in healthcare, if you just go in pretty much everything, misinformation is everywhere. And I think that is certainly one of the downs. Social media has a lot of pros, but there's a lot of downsides to social media. But this is the world we live in and we have to adapt to it.
Yeah, no, I completely agree with you. And then now as a primary care physician myself too, I think that building that trust and those longitudinal relationships over time, both in person with your patients in the exam room and also by cultivating a social media presence, I think has really tremendous value. So we're preaching to the choir, I think, here. Tell us, what are some of the biggest learnings that you've had in the past 15, 20 years you've been doing this? And what do you think is the biggest real benefit for physicians to speak up on these platforms?
So let's start with the biggest benefit first. I think that is what I alluded to before. So physicians are able to share their stories and advocate for the profession. Because as we know, there's a lot of issues that affect the profession today. We talk about physician burnout, right? 50% of clinicians are experiencing symptoms of burnout, and that's even before the pandemic. And now I'm sure that number is even higher. And a lot of the decisions that physicians make is out of their control. And I think that's one of the biggest factors that's leading to clinician burnout is that there's just a loss of clinician empowerment, right? We lose control of sometimes our schedule, and we have all these bureaucratic obstacles that we have to do, especially in the primary care setting. There's a lot of bureaucracy, and that impedes our care with patients. So I think that by sharing these stories on social media, whether it's through a webinar or podcast like this, or writing on a blog, or really elevating or even going to mainstream media where we can share those stories. And that's important because healthcare decision makers, it could be healthcare administrators, it could be politicians, listen to us. And most importantly, patients, they read these things too, because if patients are on our page and they understand some of the trials and tribulations that physicians go through, that's going to impact the care that we give to patients. So I think that social media, his biggest strength is really elevating our stories and making everyone know what goes on behind closed doors and some of the difficulties that physicians face when treating patients. In terms of the biggest learnings over the past decade or so, I think being online, there's obviously a certain amount of animosity, to say the least, right? Yep. We just live in such a divisive society. Everything is politicized. So that is something that's a little bit difficult to navigate. Whenever one has a strong opinion, you're going to have half the country disagree with what you say. So I think it is important to acknowledge that, especially with healthcare, that there are always several sides to whatever point that you're trying to make. And healthcare, as we know, there's a tremendous amount of gray shades, so to speak. So in social media, I think it's important to acknowledge different points of view, acknowledge when you're wrong, because I think one of the things that we talk about is building trust online. There's a lot of distrust in our healthcare institutions. There's a lot of distrust of the medical profession that has been magnified, certainly during COVID. So I think trying to find a way to navigate that context has been tremendously challenging, and it remains challenging going forward.
Yeah, and you touched on three things, but two, especially that trust, that's so important. And I think that's almost like the biggest value add, is we are trusted messengers too. And we don't want to do anything to undermine that trust. And I think to your point, admitting when we're wrong, admitting when information changes, admitting when our opinions have just shifted. And who would have known that bloodletting ended up being a bad idea 100 years ago? So medicine evolves and changes. And I think that we need to just make sure that we continue to speak up and advocate for what is general consensus and what is scientifically evidence-based at that moment, right? Which obviously changes us too. The other thing you touched on is podcasts, and which is a relatively new medium. So tell us more. I know you have launched your own podcast. Tell us more about podcasting and how that sort of fits into that role as well.
I think it goes to what I said earlier in terms of consumers having so many different streams of information to absorb, right? So back 10, 20 years ago, you maybe read a newspaper, you turn on television and watch a nightly news. But now we just have so many options in terms of consuming that information, and health information, of course, is part of that as well. It could be an email newsletter. It could be the New York Times online. It could be, of course, podcasts and YouTube and LinkedIn and all the social media sites. So I think it's important for clinicians just to use these platforms, again, to propagate reliable healthcare information. So specifically with podcasts, it's been tremendously impactful for me because it's something that I've always wanted to try. And I started my own podcast 2 years ago, and it's a daily podcast where I'm able to elevate voices across the healthcare spectrum. And it's not just physicians. I also have advanced practice providers. I have patients, and really everyone in healthcare should learn from each other. And I have KevinMD.com, where they have their stories in written form, but then on a podcast, I'm able to talk to them directly, and they can share their own voices and their own words. And I've learned so much because my job is really easy. I just really ask questions. I sit back, and experts from across the country, and these are experts where you would have a hard time talking to under normal circumstances. But on my podcast, I have 20 minutes of their undivided attention, and I could ask any question I want. And it's just been a tremendous learning experience over the last couple of years. And it's again, a powerful way, again, for voices across the healthcare spectrum, so they can be.
So you guys heard it here directly from Kevin MD. My job is really easy. I just sit back and ask questions. No, I'm easy. What would you say to people who maybe think that physicians shouldn't enter this space right now, which is very messy with an overlap of science and social media and politics, and can be overwhelming to some degree, and can be very messy? What do you say to people who think that the physician or the trusted health messenger voice really doesn't have a place there? What would you say to them?
Yeah, so I think that's a common perception, and a lot of physicians, we're busy. We obviously have to see patients or do procedures, go to the hospital, and you come back, you do all this paperwork, and there's enough going on in our professional lives. Why do I need to have another headache? Why do I need to be involved in social media? All I hear about is physicians getting fired because of what they post on Facebook. They just hear the negatives, right? So my biggest response to that is that if physicians aren't on social media, someone else is going to go online and propagate potentially false information and propagate misinformation. And I think that's been seen with childhood vaccines, right? You have that false connection between vaccines and autism. And I don't think physicians were fast enough to go online to dispel those myths. And what happened? You have all these pseudo practitioners propagate myths about vaccines and undermine the public perception on vaccines, because I think we in the medical profession has been too slow to embrace going online. So I do think that physicians have a responsibility to be in that public space and be where patients are and be reputable sources of health information. Because if we don't do it, if we don't go online, it's not like patients are going to stop going online to look for health information. Someone else is going to replace us, and that's going to further undermine the trust that they have in the medical profession.
Yeah, that's so well said. I agree with your sentiments 1000%. And there was a question here on the Facebook comment. At this point, there seems to be thousands of bloggers and podcasters. And what do you think a consumer of health information should look for in a health podcast? And what types of things would probably be more impactful than others and make people want to listen and learn?
Yeah, so many different types of health podcasts that are out there, right? A lot of physicians have a podcast. So certainly whatever their niche is, there's podcasts specifically about COVID. There's certainly what I do, which is share stories. There's podcasters by someone like Sanjay Gupta on CNN, these kind of higher profile physicians. So I think it depends on what you're looking for. I also want to say that when it comes to finding trust online, I think it's important to know what to look for and who to trust, because there are, of course, a lot of physicians who also not always accurate in terms of the medical information that they have. So what are some of the things that you look for? And I think a few years ago, I would have said, look for traditional healthcare institutions, look for .gov websites, look for hospitals and academic medical centers. But I think now, as you can see, everything's been so politicized that even trust in those institutions have been undermined over the years, right? Yeah. Just to expand what we talked about earlier, how do you know who to trust? And to me, I think that the biggest characteristic I look for is really just humility, right? So I think that if the podcaster or if whoever is giving the health information, if they're willing to admit mistakes, admit when they're wrong, and sometimes even admit that people from the other side of the political spectrum may have a point at times. Mm-hmm. Having that humility, to me, I think is one of the biggest signs of trust. So that's really the biggest thing that I recommend. So whenever someone asks me, who can you trust online? I think look for someone who has that humility, someone who is willing to sometimes reach across the political aisle, someone who sometimes admits when they're wrong, or sometimes admits when political opponents or have a point where they don't have that. Look for people who have that humility. And I think those, to me, especially in this day and age, are some of the more trustworthy options.
Yeah. One thing that I always look for too is looking for people that sort of are trying to stay more positive or more collaborative, as opposed to just black and white sort of, or attacking other individuals as well too, which happens a lot, unfortunately. So those are the other things that I look for, people that are trying to take a balanced approach and have more of a discourse as opposed to.
Absolutely. You don't want people who are just so dogmatic in their thinking, right? Yeah. So people who are willing to be flexible, because let's be honest, science is changing, healthcare is changing. COVID has seen that the science of the pandemic changes by the week. And I think that these opinion leaders that we have on healthcare, it's okay that they adopted that changing science.
Yeah. So now that we've convinced all of our listeners and all the physicians out there to join social media, what are some tips or advice that you have for people that are interested but aren't quite sure how to get started? I sort of think about the 3 stages of social media use. Those are people that are there and looking and learning, those people that kind of maybe comment, and those people that create their own content as well too. So what would you say to people that want to get more involved and do more social media work but aren't sure how to get started?
So you alluded to this in your lead into this. You want to go in a stepwise progression, but even before that, you want to ask yourself why you want to go into social media. So never just go into social media because someone told you to, just because the marketing department told you to, because that's never a good reason to go into social media. You always want a purpose. So the 3 main purposes that I see is, number 1 is we talk about that education piece. You want to be a reputable source of health information to the patients you see and influence outside the exam room. The second piece is like the online reputation piece, right? Because patients do Google their clinicians online, and sometimes going on social media to proactively create an online reputation is one of the best ways where you can define your online footprint and not be defined by these third-party rating sites. And the third way is what I talked about earlier about clinicians having a voice so we can advocate for a profession. So generally it falls in those 3 buckets. And I think that once you find purpose, then you could take that next step. And you talked about the progression, right? You could dip your toes in social media first and maybe have a profile on, say, LinkedIn, for instance. And that's a fairly benign thing to do. But if you have a presence on a site like that, when people Google you, at least you control that site and you show up on a Google search and you're not defined by these third-party sites. At least you control that information. And then if you get comfortable with that, you can take the next step. And like you said, you don't necessarily have to create content, but at least you can share content. So if you have a Facebook page or a Twitter page or LinkedIn, maybe you could just link or share reliable healthcare information. If a new study comes out, you can maybe share a perspective on that, or a new drug comes out, or if there's a drug recall, again, share things and you want to use your network to propagate reliable healthcare information. You don't want to share things that are pseudoscience or things that are proven to be unreliable. And then the third part, once you get comfortable with that, will be then content creation. And then there's so many avenues in social media that fits one's strength. So if you're great on camera, of course, there's like YouTube. If you're a great writer, there's blogs. If you want to do more short form things, you can do that on LinkedIn and Facebook. But so you want to find a platform that really suits your personality and suits your strength, and then create that content that fits into some of those goals that we talked about earlier, whether it's educating patients or commentating on news or advocating for a profession. So find your purpose first, and then take your stepwise progression based on your comfort level on being online.
Yeah. I think the other thing too, I always tell people is just pick maybe one, maybe two platforms to start with. You don't have to be all things to everyone at once. One of my good friends, Dr. Vicky Chan, does these like TikTok, Instagram dances, which are just amazing. And she's great at it. And that's her thing versus people who are much better at blogs, for example, too. So I always tell people like pick one, maybe two sort of avenues and start there. And then you can expand as you feel comfortable. That's great advice too. We have a question here in the chat also too. Sure. Physicians, particularly working for large institutions, can sometimes run into some struggles with the public affairs department or the comms team, which is so used to controlling or understanding or putting out the narrative. And whether we say it or not, if we work for an institution, we are a representative of that institution too. So how do physicians navigate that kind of responsibility to their organization and their institution, but also their own personal brand and reputation on social media as well too?
So I always advise physicians to be transparent, right? So you want to be transparent with your organization, and there's so many organizations out there with varying policies when it comes to social media. I can say for many large organizations, the marketing team is very eager to partner with clinicians, right? So they actually want more physicians to partner with them and create videos to promote the hospital or their practice or whatever procedure that they're doing. So I think that first off, partnering with the marketing team certainly would be the first step. In terms of branching out, and if you want to do your own brand outside of your employer, you always have to be transparent because you work for your employer first. Make sure that contractually it's okay. I always advise transparency first before going out and doing something that your employer may find out later and may frown upon. So I always advise transparency first. And again, if your personal brand runs counter to what the organization wants, so that's another discussion to be had. But I think that in general, you do want to be transparent. You want to make sure contractually it's okay. And in most cases, I would just say if you have a marketing department, to partner with them, because a lot of times that your goals and motivations may be aligned.
Yeah, no, I think for me personally, I can speak being a Permanente physician and being part of a massive healthcare organization. I did a lot of work ahead of time and spoke with my local comms team and my regional comms team to let them know who I am, what I'm about, and how I can, again, like I said, really partner with them on this work too. And so it's been a fantastic relationship that I've been able to foster and grow with many individuals across our organization, including the folks that help produce this podcast. So shout out to Ben and Maria. So thanks, guys. So this has been fantastic. We could probably go all day long too, but I know your time is short. So tell us again how people can find you and find your blog and your podcast.
Yep. So everything is at KevinMD.com, and we find a blog, and it's not just me, but it's really stories from across the healthcare spectrum. And you really learn a lot from just reading from your colleagues and reading from people that are adjacent to you in the healthcare spectrum. I've learned so much just from reading the stories on KevinMD. And in terms of my podcasts, it's KevinMD.com/podcast. And then you can hear the KevinMD authors in their own voices share their stories. So those are the two places that I would go to.
Fantastic. Dr. Pho, thank you so much for joining us. I really enjoyed this conversation. It means a lot to us and all of our viewers. You took the time today.
Thanks for having me.